All right, so we're doing the lip implants now. The way we start with this is inject a little bit of local anesthesia in the corners of the mouth because that's where we'll be putting the lip implant in. We'll just move our tube around since we just did the Mommy Makeover Deluxe on this patient. The tube is all sterile for us. We'll also inject along the lip edge as well. Alrighty, so we've numbed up the patient, and there's a little bit of epinephrine in there, so that'll also help minimize bleeding. So we just make an incision, but not with a knife. We make an incision with these iris scissors right in the corners of the mouth. Alright, so just making a plane for ourselves here.
That's pretty cool.
Making the plane, got the scissors going in one end of the corner of the mouth, going towards the other corner of the mouth. Won't make it all the way, so I'll join it from the other side now. Now we'll go in the other side and try and join up with that track that we made from the other side of the mouth. Alright, so we've kind of made our way all the way over here. So we'll come on back out. Okay, so this is a tendon passer. It's normally for passing tendons, but in this case it's going to be used for passing a lip implant from one corner of the mouth to the other. Alright, so we'll pass the tendon passer here, and because I made that plane before, it'll just slide right across. And there we are, coming out the other side of the... Bring this back. Now you can see it's coming out through the... So it's kind of gruesome looking, but that is going along a natural surgical anatomical plane, and it is appropriate. And now we'll put the implant here and pull it back through. Okay. The implant into the tendon passer, grab onto that real tight, and then we'll pull that back through. So now you can see both ends of the implant are exactly where I want them to be. Now she has a nice fat lower lip, and the implant's exactly where we want it to be. Repeat the same thing with the upper lip now. So again, just creating a plane here. We've made our plane. Now we'll pass the tendon passer back again through the upper lip. It slides really nicely and easily, meaning I'm in the right plane, in the same plane, and then it comes out on that other side. So now we'll take the other implant. For the record, these are solid silicone implants. They're not liquid, so they can't bust or anything like that. It's just a solid silicone gel implant. And this is actually 4 millimeters by 55 millimeters, so you can get different sizes, and this is the size we got for this patient. And pull it back through, and that's it. Incisions are both in the corners of the mouth, so nobody will be able to see them. We'll just put a quick stitch in there. Alrighty, so while I'm sewing it up, let me tell you that we can actually do this under local anesthesia and a dental block. Even though this patient's under general anesthesia for other operation, she wouldn't have to be. Okay, so we've cleaned the patient's face off with acetone. You can see she has these deep wrinkles around her mouth, deep wrinkles on her forehead. So we're going to go ahead and peel all that. And here is the Phenol Croton oil peel. Doesn't seem like that big a deal, but this is the Phenol Croton oil peel. We're just going to mix that up a little bit more with this Q-tip, and then we're going to apply the Q-tip, and you're going to see the skin start to frost. There we are. You see that area that I just applied? It's going to start to turn white. These deepest wrinkles, so it can really resurface that top layer of skin. Okay, so now that we've gotten around her mouth pretty aggressively, you can start to see how this is more of a whitish color, whereas the area I haven't treated yet is obviously just looks like regular skin. So now we're going to work on the area around the eyes. And now we're going to do a little bit of her forehead at the same time. Get these deep creases in between her eyebrows called the 11s. You can actually treat these with Botox, but more permanently you can treat it with a deep chemical peel. Okay, so we've treated the areas around the mouth with multiple passes with the chemical peel. multiple passes around the eyes because that's where the deepest wrinkles were. But then we also did at least one pass around the rest of the face and the forehead just to keep the skin and the face color and tone very even. Now we're going to put Aquaphor ointment on really heavily to keep her skin as moisturized as possible. Not very scientific, you just lather it on with at least one good layer. And just right into her hair so we make sure we don't miss any spots. So because the chemical peel really needs a lot of TLC, we'll actually have this patient come back tomorrow to make sure that she's putting on the Aquaphor ointment appropriately. We just want to make absolutely sure that the peel is doing appropriately and she's keeping her face moisturized so that the peel doesn't go too deep.